The CDC Vaccine Advisory Panel voted today to stop recommending newborns receive their first dose of the hepatitis B vaccine within 24 hours of birth. That recommendation stood for more than 30 years. The panel now says parents should wait until the child is 2 months old if the mother tested negative for the virus. Joining me now is CBS News Chief Medical Correspondent Dr. Jon LaPook. Dr. LaPook, I want to read for our audience something that Senator Bill Cassidy, Republican from Louisiana, said in reaction to this. I want to have the control room bring this up. As a liver doctor who has treated patients with hepatitis B for decades, this change to the vaccine schedule is a mistake. The hepatitis B vaccine is safe and effective. Your other thoughts, Dr. LaPook?
Well, you mentioned that Senator Cassidy came out with a strong statement. He is a gastroenterologist, as am I. And I have to tell you, people may not know because, of course, the vaccine's been very effective. And a lot of times people have hepatitis B, they don't even realize it. About at least half of the time, there are these chronic carriers. But I have been by the bedside of people as they are dying from this brutal infection, okay? You die from liver failure, you die from liver cancer, and I hate to be graphic, but one of the complications is something called esophageal varices, where the veins sort of back up into the throat and you vomit up blood, and I've had people bleed out and die in front of me. That's the context where in 1981, just as I was sort of in the middle of my training, this vaccine came out. It was a miracle. And if you look over the next years, the number of people who had hepatitis B chronically fell in half from about 1.2 million to about 660,000. And I should say that even though children, babies, the most common cause of getting it is from an infected mother, and then during childbirth they're infected, you can get it later on from household contacts. Just from contact, it's a very hardy virus. It's in secretions of all kinds, and just close contact with a grandparent or a caregiver can actually pass on this virus.
Dr. LaPook, quickly, can the CDC ignore this? And if so, what effect does that have on insurers or others downstream?
Well, there was a statement today saying that insurance is not going to be affected. That remains to be seen. I have to say that the bigger discussion here really is about the role of public health. I just got off the phone with an infectious diseases expert who used to be in public health on the federal level, and who told me, look, it's a good idea to review the data out there periodically. This has been done with this vaccine, and there's no new signal of safety or of a problem. It's very effective, and I think and you listen to the conversation this morning, as I did, it was contentious. There's a lot of back and forth. And sort of behind it was the issue of what is the role of public health? And the role of public health is really to look at the 200 million people, hundreds of millions of people, and give advice for everybody, okay, based on the best available science. If on top of that, after that, people want to make individual decisions after discussion with their healthcare provider, fine. But I think the point is made by a lot of people I've spoken to is you don't handicap the advice because you're afraid that people won't follow it because of their individual preferences. You give the best possible advice, and that's your advice. And then after that, if people want to make their own informed choices, then you go for it.
Dr. Jon LaPook, as always, thank you very much.